What if a simple change in the color of your morning urine was the only warning your body gave you before a silent, deadly process began inside you? Every year, more than 60,000 people in the United States receive a diagnosis that carries a devastating 11% 5-year survival rate. It's a disease that kills more individuals annually than breast cancer, yet public awareness remains dangerously low. But what if you could recognize the whispers your body sends months before a formal diagnosis becomes possible? Studies indicate that nearly 3/4 of patients are unaware their symptoms are even related to a serious condition until the disease has already progressed to an advanced, difficult-to-treat stage. This isn't about fear, it's about knowledge. Your pancreas, a fist-sized, deep-seated organ, is a silent workhorse producing insulin to regulate blood sugar and enzymes to digest your food. Because of its location, routine physical exams often miss early issues, making your own vigilance the first and most critical line of defense. Today, we're revealing 8 critical signals that could indicate pancreatic cancer. Some of these signs are so commonplace you might be experiencing them right now, dismissing them as nothing. Groundbreaking research from institutions like Johns Hopkins has shown that recognizing a cluster of just 3 of these symptoms can boost the chances of early detection by nearly 70%. We are not here to give medical advice, but to empower you with information. Let's begin. Disclaimer: this content is strictly educational and not a substitute for professional medical advice. Always consult a qualified healthcare provider for any health concerns or before making any decisions related to your health or treatment. All information is research-backed, and sources are linked below. If you find this information vital, please support this channel by liking and subscribing to Define Health Secrets. Now, let's uncover the first warning sign. Symptom number 1. The unexpected shade in the toilet bowl. Your urine is a powerful diagnostic tool, and its color tells a detailed story about your internal health. In the context of pancreatic cancer, a tumor often develops near the bile duct, the pipeline that carries bile from your liver to your intestines. When this duct gets compressed or blocked, a substance called bilirubin, a normal byproduct of old red blood cells, can't be eliminated through the usual channels. Instead of being processed and giving stool its normal brown color, it builds up in your bloodstream. Your body's emergency protocol is to flush this pigment out through your urine. Even if you're drinking plenty of water, you might notice your pee turns a deep amber, the color of brewed black tea, or even a dark cola-like brown. Most people immediately think they're just dehydrated. But if you're well hydrated and this dark color persists for several days, it's a flag your body is waving. This change often precedes the yellowing of your skin or the whites of your eyes, making it an incredibly early clue that something is obstructing the normal flow. Symptom 2. An ache that feels like it has no source. The nature of the pain associated with pancreatic cancer is distinct. It's not a sharp stabbing pain from a meal. It's a dull, persistent ache that seems to originate from deep in your core. When a tumor forms in the body or tail of the pancreas, it can press against a complex network of nerves. This often creates a sensation that radiates from the upper abdomen straight through to the middle of the back, like a tight band being pulled around your torso. Many describe it as annoying discomfort that gets noticeably worse after eating a meal or when you lie flat to sleep. Initially, this pain might come and go, offering false reassurance. But as the mass grows, the pressure becomes more constant and intense. This isn't the fleeting pain of indigestion. It's a persistent signal that a space-occupying lesion is interfering with the delicate machinery of your abdomen. Symptom 3. Feeling full when you've barely eaten. We all get bloated from time to time, but the sensation caused by a pancreatic issue is different. It's a profound and uncomfortable feeling of fullness, known as early satiety, that sets in after just a small amount of food. This happens for 2 primary reasons. First, the tumor can physically press against your stomach, reducing its capacity. Second, and more insidiously, the cancer can disrupt the pancreas's ability to produce and secrete the potent digestive enzymes needed to break down food. This isn't just indigestion. It's your digestive system crying out for help. The abdomen can feel swollen and distended, a tightness that antacids and dietary tweaks simply can't relieve. If you find yourself consistently unable to finish a normal meal and feeling miserably full for hours afterward, it's a pattern worth investigating. Symptom 4. An invisible swelling in the upper right side. The pancreas is a linchpin in your digestive system, and when it fails, it triggers a domino effect on neighboring organs. As a tumor obstructs the bile duct, bile backs up like a dammed river. Your gallbladder, normally the size of a small pear, becomes a reservoir for this backed up bile, causing it to stretch and enlarge. Simultaneously, your liver, which produces the bile, can also become swollen and congested. While you can't see this, a doctor can often feel this enlargement during a physical exam as a firm mass beneath your right rib cage. Medical imaging like ultrasounds and CT scans reveal these changes clearly. This physical alteration in the size of your gallbladder or liver is a major red flag, a tangible consequence of the downstream blockage caused by a tumor. It demonstrates how a problem in one small gland can cascade and affect the entire abdominal landscape. Symptom 5. Unexplained and dangerous clotting. Pancreatic cancer has a notorious ability to make your blood hypercoagulable, meaning it becomes much stickier and prone to clotting. This condition, known as Trousseau syndrome, is a paraneoplastic phenomenon where the cancer cells release substances that disrupt the body's normal clotting mechanism. These clots most often form in the deep veins of the legs, a condition called deep vein thrombosis, or DVT, causing swelling, warmth, and redness in one calf or thigh. The true danger comes when a piece of this clot breaks free and travels to the lungs, causing a pulmonary embolism, a life-threatening emergency. Symptoms of a pulmonary embolism include sudden, sharp chest pain, difficulty breathing, and a racing heart. If a seemingly random blood clot appears, especially without a clear cause like an injury or surgery, it can be an early sign of an underlying cancer, prompting doctors to look deeper. Symptom 6. Fevers that come in waves. Your body runs a temperature when it's fighting an invader or dealing with significant inflammation. In pancreatic cancer, especially when the tumor causes inflammation of the pancreas, known as pancreatitis, or blocks the bile duct, a condition called cholangitis, your immune system launches a full-scale response. This manifests as cycles of fever and chills. You might feel intensely cold and shivery one moment, only to be burning up with a high temperature the next. Unlike the fever from a standard cold that runs its course in a few days, these episodes tend to recur. They are often accompanied by drenching night sweats that soak through your pajamas and sheets. This isn't just feeling a bit warm. It's a systemic sign that your body is engaged in a significant internal battle against inflammation and obstruction. Symptom 7. A fatigue that rest cannot cure. We all get tired, but cancer-related fatigue is in a league of its own. It's an overwhelming, bone-deep exhaustion that doesn't get better with sleep or rest. This happens because the cancer cells are metabolically active, competing with your healthy cells for nutrients and energy. It's not just feeling sleepy. It's your body's fuel being hijacked. Simple tasks like walking to the mailbox or folding laundry can feel like marathons. This physical depletion is often coupled with emotional changes, creating a cycle of mental fog, depression, and anxiety. If you are sleeping well but still wake up feeling completely unrefreshed and struggle to summon the energy for daily life, it's a level of fatigue that warrants a conversation with your doctor, as it points to a systemic issue far beyond a poor night's sleep. Symptom 8. A fundamental change in digestion. The pancreas is your primary enzyme factory, producing the chemicals needed to digest fats, proteins, and carbohydrates. When a tumor damages these cells or blocks the pancreatic duct, these enzymes can't reach the small intestine. The result is a condition called malabsorption. Food, especially fats, passes through your system undigested. This leads to a few telltale signs. Your stool may become pale, bulky, greasy, and foul-smelling, a sign that fat is being excreted rather than absorbed. You might also experience nausea, vomiting, and an unexplained weight loss because your body isn't extracting the calories and nutrients it needs. This is a direct sign that the digestive system is failing at its most basic job. Recognizing these 8 warning signs is the first step. Early detection can change the outcome. If this information empowered you today, please hit the like button to help others on Defined Health Secrets find this crucial content. Don't forget to subscribe and tap the bell so you never miss a video. We've curated more essential health investigations for you to watch next. Your journey to being informed starts now.